Hello everyone and welcome back to my channel Nursing Guru 24. I am Vinay and today we are going to discuss about a very important topic, that is autoclaving, which is a frequently asked topic in exams like NORCET, ESIC and various state and central government staff nurse recruitment exams. Autoclaving is not just a routine hospital procedure, it is a critical infection control measure and examiners love to test your understanding of it. Whether it is a sterilization temperature or timings or indicators. Questions from this topic often appear in both MCQs and they appear as short and long essays. So in this video, I will cover what autoclaving is, how it works, then key parameters like pressure, temperature and time, then autoclaving cycle, quality control in autoclaving, and most importantly, at the end, tips for competitive nursing exams. So make sure to watch till the end, take notes to help with your last minute revisions. Remember, mastering basics like autoclaving not only helps you score better in exams but also makes you a more competent nurse in a real clinical settings. If you are new to my channel, don't forget to subscribe, like and hit the bell icon so you will never miss an important topic. Let us get started. What is autoclaving? Autoclaving is a moist heat sterilization method. Autoclaving is the moist heat sterilization method which uses high pressure steam to kill all microorganisms including bacterial spores. It is the method of sterilization where all the microorganisms including their spores are killed. It is the most reliable and widely used method in hospitals for sterilizing surgical instruments, dressings and some laboratory equipments. Then what is autoclave? Autoclave is the machine used for autoclaving. Autoclave is the machine used for autoclaving. Then how does an autoclave work? Autoclave works by steam generation, where water is heated to produce steam and temperature and pressures are set at 121 degrees Celsius at 15 psi. Psi is the pressure. 121 degrees Celsius at 15 psi for about 15 to 20 minutes. This is the standard setting. 121 degrees Celsius, 15 psi for about 15 to 20 minutes. This is the standard setting. In case of emergency, if we need any instruments very early, then we set temperature at 134 degrees Celsius at 30 psi for about 3 to 5 minutes. This is called as flash sterilization. Then the produced heat penetrates through some materials which are kept in autoclaving. That stream destroys microorganisms by destructing their proteins and enzymes. Once the sterilization is complete, items are allowed to cool down and they are dried to prevent contamination. This is how the autoclaving works. Then what are the uses of autoclaving in hospitals? We all know forceps, scissors, scalpels and other surgical instruments are sterilized through autoclaving. Then dressings, gauze and drapes are also autoclaved in autoclaving. Even some glasswares like test tubes and all, they are also autoclaved. Some culture media after preparation. Then some heat resistant things are also autoclaved in autoclaving machine. Then what are the advantages of autoclaving? Autoclaving is highly effective because it kills all the microorganisms including their spores. Then it is fast and economical compared to dry heat methods. Then it penetrates deeply into the fabrics and wrapped items. Hence, it kills all the microorganisms by penetrating. Then if we see the disadvantages, autoclaving is not suitable for heat sensitive items like plastic syringes, some fiber optic cables and all. Then it can corrode metals if not dried properly. If the autoclaved metals are not dried properly, it can cause corrosion. Then it requires regular maintenance like calibration, water quality checks, etc. Next, we will see the steps which are there in autoclaving process. First step includes loading. Arrange items loosely for steam penetration. Second step is pre-vacuum. Here the machine removes air for better steam contact. Then third step is sterilization phase, where we set temperature at 121 degrees Celsius for 15 to 20 minutes. Next step is drying phase, where machine removes moisture to prevent rusting of the inner lining. And last phase is unloading the sterilized instruments by using sterile gloves to handle them. To check the quality of autoclaved instruments, that is quality control. To know whether the sterilization is effective or not, we use some indicators in hospitals. They are biological indicators, chemical indicators and physical indicators. First one is biological indicators, where we check Bacillus stereothermophilus spores. Bacillus stereothermophilus spores are killed or not. If they are not killed completely, then the sterilization is not effective. If they are killed completely, then only the autoclaving is effective. Then second one, chemical indicators. What we will do here we stick some paper tapes over the instruments to be sterilized. Tape changes the color if it is exposed to heat or if it is autoclaved. Where in chemical indicators, the paper tapes change their color when they are exposed to heat. Then third one I told physical indicators. Here we check temperature and pressure gauges. This is also an indicator. These are the three indicators of quality assessment of autoclaving. Next we will see some common mistakes we do in autoclaving. First one is overloading. What happens if we overload the instruments with autoclaving? It prevents the penetration of steam into the instruments. Thereby there will be no effectiveness of sterilization. Then trapped air. It reduces sterilization efficiency. Then incorrect timing. I told 15 to 20 minutes for standard autoclaving. If we set for 10 minutes, 5 minutes, there will be no effective sterilization. Then wet packs after cycle can lead to contamination. If they are not dried, that again leads to contamination. Then some autoclaving standard setting is 121 degrees Celsius, 15 psi for about 15 to 20 minutes. Then flash autoclaving, where we set a temperature at 134 degrees Celsius, 3 to 5 minutes in case of emergency or in case of emergency use. Then some indicators I told. In biological indicators, we will check for Bacillus stereothermophilus microorganism. Then in chemical indicator, we stick some tapes and we observe for color changes. So autoclaving is the gold standard for sterilization in healthcare. As a nurses, we must know how to autoclave and how to set the temperature and what are the mistakes we commonly do in autoclaving. Correct loading and unloading of things in autoclaving machine is very important while doing autoclaving. And also there should be regular quality checks. They should be done periodically. Hope you understood the autoclaving. If you have any doubts, you can ask in comment section. Thank you.